Hey, welcome back to our second show. I'd like to thank all the viewers who tuned in last week. We had over 5,000 views on the first video, and I want to deliver some high quality content for you again today. If you'd like to keep track of our website or Facebook page, please go ahead and like the page. Therefore, you can get updates every week whenever we do these live videos. So today, what I'd like to talk about is thyroid health. According to the American Academy of Endocrinologists or clinical endocrinologists, there's over 27 million people in the United States who have hypothyroid, and about half of them are actually undiagnosed at this point. So if you're feeling tired, fatigued, hair falling out, make sure and go and check your thyroid in order for your doctor to help you in terms of restoring your health, okay? Today, obviously, we're talking about the functional medicine approach and the functional neurology approach to thyroid health. So we're gonna go into just the basics. What does the thyroid do and how does it impact our body, okay? So the thyroid hormone actually starts in the brain. There's a place in the brain called the hypothalamus that releases a hormone called thyroid releasing hormone, and that goes to the pituitary gland. Pituitary gland is basically back just behind your eyes. Okay, it's a little pea-sized shaped gland, and that controls some of the endocrine system. So your pituitary releases TSH, thyroid stimulating hormone, which is the marker that your primary care physician or endocrinologist will check to see if you have a hyper or a hypo or overactive or underactive thyroid. So it actually starts in the brain, the first two steps. So it's hypothalamus, which is part of the brain, and the hypothalamus is impacted by multiple neurotransmitters, but two of them which are very important is dopamine and serotonin. So let's take a quick look here. Hypothalamus is impacted by neurotransmitters called dopamine and serotonin. It's activated and it talks to the thyroid, to the pituitary gland. The pituitary gland releases TSH, thyroid stimulating hormone. Then it stimulates the thyroid to produce two basic hormones. There's more than two, but the two basic hormones, which is T4 and T3. Now you have to understand that T4 is the primary production of the thyroid, and T3 is the minority production. So if you have T4 production, which is 93%, and you have T3 production, which is about 7%, you have to understand why there's a discrepancy in the thyroid hormone there. T4 is the inactive form. It has a minimal physiological effect on our body. So T4 needs to convert to T3. Okay? T3 is the active hormone. So T4 inactive needs to convert to T3 active, and it has to be converted into that hormone. The conversion of those two, of T4 to T3, actually occurs in your liver and your gut. I said it. The conversion occurs in your liver and gut. Okay? So about 60% of production or conversion occurs in the liver, and about 20% goes into the gut and is converted into an active hormone of T3. The reason that's important is because your liver and your gut function is crucial for thyroid management. And most of the doctors miss this point is because they're always focused on TSH. So if your TSH is too high, you need a T4 medication like Synthroid, Levoxel, levothyroxine, etc. Okay, so they're always focused on the TSH number. Here in our office, we look at all the markers and say, is your T3 low and your T4 is fine? Then we need to convert your T4 to T3 to make the active hormone, and the active hormone which has a broad physiological effect. Thyroid hormone is important for brain function, gut function, liver function, bone health, muscle function, cognitive function, you name it. Every receptor, every cell in your body has a receptor for thyroid hormone. And without the proper levels of thyroid hormone, your physiology will change. You will feel fatigue, you have sleep disturbance, constipation, or sometimes diarrhea. You have hair loss, a third of your eyebrow may be thinning out. You're cold all the time, your hands and feet are freezing all the time in the dead of summer, and it has a broad physiological effect. So again, let's look at this real quick. It's brain hormone, the brain, the hypothalamus, which is impacted by two neurotransmitters, serotonin and dopamine, and there are others, but I'm just generalizing here. Serotonin and dopamine. Hypothalamus is stimulated to stimulate the pituitary gland, and the pituitary will release TSH and tell the thyroid gland, which is right here at the base of the neck, to release two hormones, T4 inactive, T3 active. The primary production is T4, so the conversion of T4 inactive has to occur somewhere, and it occurs in your liver and your gut. Okay, and that's crucial because in order to restore liver and gut function, there's certain protocols to do that. Okay, so if you have poor liver function and poor gut function, you may always feel tired and never feel the same. Okay, so we have to improve those functions. Now, let's take a quick look at some of the markers that can be tested for thyroid. Number one is TSH, or thyroid stimulating hormone. Another marker is total T4, total T3, free T4, free T3, thyroid binding globulin, T3 uptake, and two important antibodies, TPO and TGB antibodies. Those two antibodies is crucial to diagnose Hashimoto's thyroiditis. The reason I say it's crucial is because the number one cause here in the United States for hypothyroid or underfunctioning thyroid is actually an autoimmune disease called Hashimoto's thyroiditis. So if the number one cause, which is about 70 to 80% of hypothyroid patients, is an autoimmune disease, why is it that in traditional medicine they only address TSH, or thyroid stimulating hormone? You take a medication for thyroid stimulating hormone, and that's the only real answer to the epidemic of hypothyroid patients. Yet, the number one cause is an autoimmune disease called Hashimoto's thyroiditis. If you address the autoimmune condition of Hashimoto's thyroiditis, then if you can really get to the underlying cause, there may be less need for medication or no need for medication if you can modulate your immune system, because that is the primary cause here in the United States. Worldwide, it's probably goiter. That's the number one cause for hypothyroid, and we'll get into that a little later in our video series about thyroid. But here in the United States, it's Hashimoto's thyroiditis. It's an epidemic of autoimmune disease. And the importance of gut function plays a huge role in recovery for thyroid issues, because the gut is actually producing quite a bit of your immune cells, 70 to 80, 90, depending on which book you look into, because the gut is important for immune function, serotonin function, or serotonin production, as well as your gut microbiome, which is important for producing vitamins and so forth, and absorption of vitamins into your system and breakdown of your foods. So I don't know, many of you might have heard of leaky gut syndrome and so forth. All these things, leaky gut, Crohn's disease, IBS, irritable bowel disorders, inflammatory disease, all of that impacts the gut. And if your gut is poor, then your thyroid hormone will not convert from T4 to T3. And those people who drink a lot and so forth, they'll take a bunch of medications, your liver function may not be as efficient, and therefore it creates problems for you in terms of converting your T4 to T3. Okay? Now what I'm going to do is because I am talking about thyroid function and physiology, I'm going to attach a document to this video. So you can download it and you can kind of look at it. It's a little color one-page document that shows you just the basic physiology of your thyroid hormone. Okay? So if you have any questions regarding thyroid, please post underneath this video, like the video so you can go ahead and receive more videos in the future. Like the page, because the more people we can get this out to, the information, the more people we can help. Okay? Now, I want to look at 2 supplements for patients, and this is just a basic idea. Okay? There is a product called here. It's called Thyroxine. This is probably looking backwards because we're on Facebook Live here, but it's called Thyroxine, and it's produced by a company called Apex Energetics. Okay, this is a great multi-purpose thyroid support. It's got selenium, it's got your vitamin A, vitamin D, magnesium, manganese, and it's got a great support. And it doesn't have actually any iodine, which is one of the few products out there that does not have iodine. And there is some controversy for the use of iodine, and we'll get into that in future videos, okay? Another good supplement, hold on one second, I gotta turn off my timer here. Another great supplement for people who have low T3 is called Thyroxine, is in Nancy, V. Okay, this is a product, again, produced by Apex Energetics, and it's a great product for converting your T4 to T3. It's got all your cofactors in there to help the conversion of your T4, your inactive hormone, to your active T3. So those 2 products are great for thyroid health in general, but again, it's not about taking a supplement for just thyroid. It's about looking at the physiology, looking at the gut function, looking at the liver function, and trying to figure out what is the underlying cause. What is triggering the autoimmune process? And as I spoke last week, food is a big thing, you know. If you have a thyroid problem, you might want to consider being on a gluten-free diet. It's a very important factor. It's the foundation for things. And that's just something I wanted to mention to you. And here is another book by one of my mentors here. Okay, let me just close that out here. So this is one of my mentors. His name is Dr. Datis Karazian. He wrote a book. It says, "Why do I still have thyroid symptoms when my lab tests were normal?" So why is it normal, and why do I have all these symptoms? Maybe you have an autoimmune disease. Maybe it's a problem of your gut function. Maybe it's a parasite. Maybe it's the food. Maybe it's something else. So here in the office, we like to go ahead and look at the deep underlying causes of any type of dysfunction, including thyroid, whether it be rheumatoid arthritis, you know, Parkinson's disease, Alzheimer's. You got to look at the underlying causes. You got to find all the immune triggers to help you finish, or help you get to the root cause and fix the underlying causes. Therefore, you can restore your health. Okay. I'd like to. For next week, we're going to be off on Tuesday because I think it's 4th of July, but I will make a video on the Wednesday, so tune in for that. One other thing is, please like the Facebook page. Therefore, you can go ahead and get the updates and spread the news. Share it with your friends and family, because I want to try to really provide good quality information for you guys. All right, so we'll see you back next week, 12:30 on Wednesday, not Tuesday, and we'll see you then. Have a great 4th of July.